Or the para, if anything else from the pain. You will do close-ended questions, give open questions. Head nodding, signposting. Signpost how? Periods, I need to ask you standard question. Sexual history, standard question about you. Sexual health, we usually ask everyone who are going through similar problem. Women health, what women health problem could be? Pregnancy, periods, pap smears. So if you think you can skip pap smear, no, you can't. That will give you a screening point of view of having any cervical cancer. We'll be doing that one scenario with Ramesh. We already done few lesbian coming with the problem. We'll come to that. Male health, child health, specific question. So today we are doing the sexual health. So sexual health, female, periods, ask periods. By any chance you're trying to get pregnant, you have to ask that question as well. So this is how we would do. Ideas. Can you skip ideas, expectation, concern? You will be judging me. I shouldn't skip idea, expectation, concern. Wherever it's required, lifestyle, smoking is required. If somebody is going to get pregnant, you did ask about smoking. Examination, simple words. At this point, I would like to have a feel of your tummy. I'm going to listen to your chest. I'm going to check the front and back of your eye if needed. And in the presence of chaperone, I will do this if it's a private. In this case, you need to know that. Basic investigation, I'll take some standard bloods to check an infection, markers, or anything. If finding, management would start with findings. Guys, 9 out of 10, maybe 7 out of 10, maybe 6 out of 10 people make this mistake. What mistake they are doing? When they see the findings, they think this finding is for only diagnosis. They don't explain. Patient want to know finding, and examiner will say, okay, this guy made mistake, he put cross on finding, because this guy is not explaining findings to the patient. You have to explain that finding, and you need to correlate that. For example, I have seen your blood results. I have done examination. I could see that you have tender on the tummy. Okay, and your blood results. So you need to explain, then break the diagnosis or your suspicion of diagnosis. Explain diagnosis in simple word. Management, urgency order. Management should be urgency order. What top thing? Start thinking that way. What is the most important thing here for the patient we need to do, or what the patient want to listen? And if you need to keep the patient, I want to keep you in the hospital. Is that okay? Will you stay in the hospital? And if you need to give medicine, you will talk about referral. If you are going to do the immediate, just now I'm going to keep you, I'm going to send you, or urgent 2 weeks, or routine referral. Shared plan, you want anything else. Is that okay with you? Well done, thank you. Okay, if you are in the British society, try to learn this skill, guys. What skill? Thank you, well done, excellent, brilliant, good, you've done well. If you tell your patient you've done well with your life, even I tell my patient you look younger than you don't need to say in the exam, because in exam there are actors, they have different ages. So, but if you appreciate someone for something what they have done, they will love it. Well done, you're doing great. Okay, shared plan, specific test, safety netting, safeguarding, reading material, and follow up. So this is how you will do. So Ramesh, let's restart. So let me see what scenarios we're left with. So we are on the male health. So on the male health, we do another scenario, which should be related to the, let me quickly show them all those scenarios, and after one by one, we'll do that. Okay, so let's see which scenario we are about to do now. Okay, so we have done with the gonorrhea, we have done with the analgesic nephropathy, and we're done with the HIV breaking bad news, and right. So now, what most important scenario we are going to do from the male health, which is the last one from the male health, which we are going to do now, is back pain. I'm not going to tell you two scenarios. I'm going to show you. So we'll do one. Either we'll do the back pain scenario, either we're going to do the demanding patient coming with the PCA or whatever. I'll show you both of those scenarios, and what the examiner want to expect from you, and what type of scenario it would be. We'll try to do that. So one scenario might be I will be doing as a doctor, and one scenario Dr. Ramesh will do as a doctor, and I'll be examiner in that one. And anyone want to do as an examiner or patient, let us know. So anyone want to become patient, because even if you become a patient, I will tell you how to act, and you will get some confidence of speaking and everything if you want to do as a patient. Anyone? Okay, so let's start with Ramesh. So, Ramesh, the scenario which I'm going to give you, 70-year-old male. Okay, I will do as a doctor that one. Okay.
Okay.
70-year-old male presented with the back pain. He had this back pain 6 months ago and it's gradually worsening, does not go anywhere, no temperature, no night sweats, no numbness or tingling, no hesitancy and dribbling or urine symptoms. He lost some weight, about 3 stones in 1 month. Clothes are loose, feeling some weakness and tired as well, struggling with the day to day activities. You like to go for a long walk but can't anymore. He thinks it's because he's just getting old. Per rectal examination is normal. Per rectal examination is normal, right? So
Okay.
I will be doing that scenario, and the next scenario you would maybe I'll tell you. We need to do 2 scenarios. Okay, one scenario, both are the back pain. So we are doing back pain. One scenario is a combined one. One is not combined one. So this one is a combined one, and in this scenario there would be a quick one. So if you want to do it as a doctor, this one or other one would be quad equina. Which one you want to do as a doctor? This one or quad equina?
I can do this one.
Well done. So I become the patient then quad equine I will do, because quad equine is I will be best at it because I'm I'm a ENT doctor. So you usually see a lot of lower back pains. So let's do
Yes.
6 months. So you need to differentiate both of these scenarios. The pain is not acute. It's a 6 month. Ramesh is a 6 month pain. And
Okay.
I'm 75-year-old. My name is Michael Brown. Like, okay.
Okay.
So what
Sound
I need to do the timer.